Good afternoon, but also good morning and good evening to all delegates connected virtually or in person with us today for this exciting session on leadership for sustainability. How can healthcare leaders meet the challenge of climate change? My name is Carlo Giardinetti, and I have a role as a sustainability lead for consulting at Deloitte, Switzerland. Personally, I approach this session with two distinctive mindset, or state of mind, in fact. On one side, I feel very worried and feel like this session should have probably happened 20 years ago at this conference. And maybe it did happen 20 years ago, but the world wasn't ready to listen and pay enough attention to it. On the other side, being a professional who works in sustainability for almost 2 decades now, I feel there is not a better moment than now to push forward. There is a momentum around the world, and there is an urgency together with this momentum around the world. So the world is ready to make the impossible happen, to work together on this challenge of global magnitude. We are capable of making exponential change. We've seen it through the past 2 years, and we will. We have an incredible line of contributors today to this session, and each will help us understanding the challenges that we are facing, but most importantly, the solutions that we can already embrace and those that are emerging. Climate change is in fact a systemic challenge, and the solutions must be crafted with courage, initiative, and leadership in collaboration. I would like to welcome our great contributors for today. We will have Dr. Elizabeth Baka, Specialist Leader for Healthcare at Deloitte LLP in the US. She will be joining us remotely. We will have Dr. Jaume Duran, Director General La Fundació Sanitària Hospital de Mollet in Spain. He is here with us. We will have Walt Vernon, Chief Executive Officer at Mazzetti in the US. He's here with us. And then we will have Dr. Nick Woods, the Chief Sustainability Officer at NHS England and NHS Improvement in the UK. And he will be joining us remotely. So this parallel session also serves us as the launch for the IHF's newly established Special Interest Group on Leadership for Sustainability. We will start the session with a video introduction to this session from Dr. Elizabeth Baka, Specialist Leader for Healthcare at Deloitte LLP in the US.
Hi, I am Dr. Elizabeth Baka, and I'm thrilled to be joining you at the World Hospital Congress. As we come together today, we are living in an unprecedented time. There is so much change happening at a global level and so much need for action, and so I'm thrilled to be talking about leadership and healthcare sustainability. We've all lived through a really tremendous last couple of years during the COVID pandemic. And what I find fascinating is despite being in this position with a global pandemic happening, we're seeing unprecedented levels of collaboration and healthcare professionals coming together to say climate change is a health crisis, and now is the time to take action. When we look at what's happening, I think this is because of two key things. The first is the science is becoming more clear by the day, that climate change isn't just some kind of far off thing into the future, it's actually impacting our health here and now. Recently, in the lead up to the climate negotiations that are happening right now in Glasgow for COP26, over 200 medical journals came together to say, this is our greatest public health threat. And this is in the midst of the pandemic. The other thing is that we're seeing more and more extreme events. When you read the newspaper from country to country, severe hurricanes, high heat days, droughts, and wildfires. Personally, I live in California, and I have suffered many of these consequences. There have been many days when it's been so bad in terms of air quality that it wasn't even safe to leave the home. There have been some days where literally it was so hot that the pool water became too hot to even swim. And this is here in 2021. Not only do we recognize that climate change has an impact across the globe, we recognize that certain communities are disproportionately impacted, and there's a huge need to take action, especially for those communities that are most vulnerable. Today, we're going to be talking with leaders across the field to talk about solutions. But while we do that, I wanted to talk a little bit about two different components of the fact that we're facing climate change and some of the actions that we're able to take. The first is recognizing that this health impact is happening here and now. As an example, wildfires, droughts, impacts on food security in terms of decreased food production, and even infectious disease patterns changing are having an impact on our health here and now. In the last year alone, news stories about high heat days causing increased mortality and morbidity, hospitals not even having capacity to take care of patients due to floods and other climate-related events, has really woken up the healthcare community. The other piece is that it's not just about the impact on health. What's different and unique from other industries is that healthcare's mission is to improve health. The thing that's ironic is that healthcare, inadvertently, has actually become part of the problem due to the global emissions. Healthcare in and of itself is very carbon intensive in its current form of operations, which we have an opportunity to change. That said, it's not just part of the problem, but it's part of the solution. Healthcare institutions, and we're going to hear from some leaders today that are already doing this to take action to decarbonize. But it's not just about decarbonization, which is different from other industries, because healthcare is also taking care of the patients that are directly impacted by climate change. There's a whole opportunity and a new thing to be thinking about, which is adaptation, resilience, and actually creating new value. What do I mean by this? For example, we know that some of these changes, despite all the actions we're going to be taking, are going to have an impact now. How do we set up our healthcare facilities to be more resilient in the face of these big disruptions? How do we think about integrating some of the data, such as air quality data, or heat data, or pollen data, or even infectious disease data, to be doing more proactive and preventive measurements? And the last is, how do we actually redefine how we think about care models? There's a huge opportunity as we go through this transition to not just think about mitigation, but to really move beyond and think about what's next as we think about the future of health and the limits and challenges with climate change, to use that as a lever for innovation and taking action. So I'm really looking forward to the discussion with everybody today, and I am excited to work with each and every one of you in terms of coming together from a collaborative standpoint to accelerate this and get to a healthier planet for both our children and each other.
Excellent. Thank you. And at this point, and before we can actually ask a few questions live to Dr. Baka, I would like to ask a question to all of you. So we will use the poll tool, and so I invite you to take your mobile or other devices that you might have here in the room, or if you're following us from home. And please connect to the World Hospital Congress application and or to the online event platform. So for those joining us virtually, you can click on the poll tab on the right side of your screen. For those in Barcelona here with us, go to the Congress app, select polls from the home screen, and select this session to cast your vote. So what's the question for you? Well, the question is this: how prepared do you feel regarding your ability to deal with climate change in your healthcare community? Right? So it goes from you feel very well prepared because you're already seeing a lot of things happening around you, and you see the solutions emerging, and you feel you are on the right trajectory and pace. Somewhat prepared, down all the way to slightly prepared, not very prepared, not at all prepared. So we will be waiting maybe a few seconds to see the result of the poll, and then we can comment those together with Dr. Baka, who is connected with us online from the US this moment. So thank you, Dr. Elizabeth Baka, for connecting with us, and also thank you very much for your very interesting introduction. Most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of this, most likely what we will see out of. Right, so we can see an expected distribution, but we can also see not very prepared as a dominant answer right now, right? And this is an interesting insight, and I would like maybe to connect right now with Dr. Elizabeth Baka, because we can really start from this question. So what is, Dr. Baka, Elizabeth, what is, in your opinion, behind this sense of unreadiness that is expressed by the audience through the poll?
Yes, well, it's great to be with everybody. So I would say that there's a huge awakening happening right now. And so this is exactly what I would have expected with the poll. And I think the great news is to have events like this to start to bring together tools and leaders to talk about ways to get more prepared. I think, one of the things is healthcare, and by its nature is so complicated. And so there's often so many other things to be thinking about, and climate change is just another area that had not necessarily been part of the kind of core strategy, but now we're starting to see the impacts. And I think, especially in light of the impacts we've seen with COVID, we recognize what a major kind of global change can have in terms of impact on healthcare directly.
Thank you. I need some technical help to see Dr. Baka on this screen, please. And so, Elizabeth, you have mentioned adaptation, resilience, but also innovation, right, in your introductory speech. And can you tell us more on what is expected of healthcare professionals of these three distinctive strategic topics? I mean, adaptation is one thing, resilience is another one, and innovation. And you are arguing that we have to deal with all the three and juggle with all the three at the same time.
All three at once, right? No, it's a tall order, but I am confident that we can do this in healthcare. So first, I would say one of the things that I think is so important, and we're seeing this play out at the COP right now, is healthcare is a really trusted voice in all of this. And so I think that just is first and foremost as we look at the responsibilities on healthcare in general, which it's really exciting because, again, we have a lot of opportunity to forge change and change the direction of how things are going. So to your question, so adaptation, this is important because we know that despite all of the actions we're going to be taking now, there are already going to be impacts to health. And so as the mission of healthcare is to really to protect health, to promote health and well-being for individuals, for employees, for communities at large, we've got to prepare so that we're able to start to adapt to those changes and be ready to meet those challenges. From a resilience standpoint, I think it's very much related to adaptation. So it's not just about adapting to the future. It's saying we're going to adapt, and we're also going to become better when these things happen. So it's not going to be as much of an impact to the system. And I think that and especially at the Congress, there's so much happening around innovation in general, with thinking about artificial intelligence or virtual health. The fact that we're here together today like this, I think, is a testament to that kind of ability to do things differently. And then the last, in terms of innovation, there's a great movement. There's been a lot of acknowledgement that we are really moving from taking care of people when they're sick. That's obviously always really important. But I think this recognition of how do we move along the spectrum to get towards keeping people healthy as we look at the future of health. And so to do that is going to require really a rethink. It's not just about applying a new, kind of addition or adjacent thing. It's really about rethinking how we do care models, how do we deploy all of these tools that are at our disposal, and how do we bring people together in new ways.
Thank you. And maybe one more thing that is really a great testimony of how fast things are moving and how much we are required to juggle between the three big tasks: adaptation, resilience, mitigation, innovation, is what is happening at COP26 these days. So I think never in the history this appointment, extremely important, has received more media attention as it has this year. So I'm pretty sure you have been following the different announcements and the different important innovation also statements that have been done. Would you want to comment any specific ones that you've heard on the healthcare, for instance?
Yeah, well, I think it's amazing. We've never seen this level of health involvement. I think there were 45 million healthcare professionals that came together and sent a letter to all of the negotiators to say, this is something we need to be taking action on now. So that alone is just really tremendous to see that kind of movement towards action. I think the other thing is we're seeing countries and health systems join in. So one of the big things is at current moment I have written down, as last I looked, 50 countries that have joined to start to decarbonize healthcare and create more resilience, so a low carbon healthcare system. And then the other thing is we're seeing a lot of health systems individually across the globe start to also sign on to this, to make commitments in terms of action to start to decarbonize their systems and create more resilience. So I think it's, it's not just a statement. These are places, and we're going to hear from one leader in particular, who's at COP today, who will be joining remotely soon, to be saying like, we're doing this and we are going to share our commitments and share our lessons learned.
And I cannot, how to say, I wouldn't do a good job if I wouldn't mention as well that nevertheless, the youth has been extremely critical, even to this COP26. It is certainly not short of announcements, but yeah, the youth and everybody, every citizen around the world is asking for action. And so this is a very critical moment. In your experience, what gets in the way of the sense of urgency and the action that is required?
Yeah, no, I think it's a tremendous, so I think before, for all the challenges with COVID, which we recognize there have been so many and much devastation globally. But I think one of the things that's happened, and this has happened in the past, is we often are not as good about thinking about the future in the long term. Just by nature, we end up being, a lot more reactionary, dealing with the things right in front of us. And we now know what can happen when these major changes happen. And so I think in terms of some of the shifts is that that was a barrier before because it wasn't right in front of us. Unfortunately, I think the other piece is not only did we have COVID, but we've also seen the climate scientists and science getting to a point where we used to say, oh, this is probably, we can't say this one event is from climate change and it's having this impact on health. We are now getting to the point where we can say, this event is, fairly scientifically proven, and we're in medicine, so we are, really looking to the science, saying this is actually as a result of climate change. And at the same time, not only are we seeing the direct health impacts, which I think is why we're seeing all of these large health systems and countries, national health systems come out with these big announcements, but it's also, everyone is feeling this much more. So we've seen, tremendous natural disasters, very severe storms that didn't used to happen, that are impacting, the health and also operations, I think is really important to mention from a health system perspective. So
thank you.
I think we're gonna move that change forward because those barriers that used to exist, I think are definitely shifting quite rapidly.
Thank you. And we will hear great stories of action, actually, from our next contributors. But I have one last question for you, Dr. Baka. It must be hard for professionals in the healthcare system to hear that today actually the healthcare system is as much part of the problem as it is part of the solution, right? So it's a healthcare, it's a solution provider. But when it comes to climate change, we have to acknowledge the fact that the healthcare system as a whole is also a big part of the problem. And so I think when we think of the new solution, leaders in the healthcare, they have to become more and more system thinkers. And system thinking is an important competence. I think also one that is very much talked about is stakeholder relations, because systemic type of issues must be dealt with collaboration, and they're not living only inside your community, but they are systemic problems. So you have to be able to go out and collaborate more. So in this sense, and as different solutions emerge, is it possible that also at a leadership level in the different hospital, we need to take a moment to pause and rethink? You know, can we reapply the same leadership that took us successfully to where we are today in the next decade that the UN has called the decade of action, because we actually have to act on these systemic changes? So what can you say about the need for leadership development to actually make the change happen?
Yeah, for sure. Well, I think one of the things that's really tremendous is healthcare, just at its core, is a systems issue, right? So when we're treating patients and they come in, we're not just treating the chief complaint or the thing that brought them in. We're thinking about all the systems. So by nature, we think about health in a systems manner. And so I think there's a lot of opportunity to apply that same level of integrated thinking to medicine. To your point, I totally agree. This is a lot of new skills, I think, in leadership skills in terms of collaborating with others. It's going to be definitely new ways of even thinking about impacts and how we minimize impacts. Usually that was not really how we thought about when we were providing care. So there will be a whole new set of executive leadership skills in terms of communicating change management, being more real-time management, and then incorporating science, which again, by nature, medicine is very good at. We all come together at these types of conferences to share best practices and what's emerging. And I think it's just this opportunity now to move that beyond just thinking about direct health, but thinking about that broader planetary health ecosystem at large in the health context.
Thank you very much, Dr. Baka. Please stay with us because we will have a panel at the end of the session. And I would like to make an applause for you. Thank you for your contribution. I would like now to introduce Dr. Joan Duran, Director General La Fundación Sanitaria Hospital de Mollé in Spain. Welcome, Dr. Duran, and we look forward to listening to your contribution.
Please, if you could put my presentation, please.
We cannot see it in the front screen. Here it is. Wonderful.
Thank you. Good afternoon to everybody, and thank you for being here. Dear colleagues, please attend from here. And other colleagues who are attending from their homes, institutions, and countries. First and foremost, it's a pleasure for me to be here today, sharing this panel to explain our experience in the environmental institution commitment. It's our history, it's our dream. I would like to thank the International Hospital Federation, first of all, especially Dr. Alexandra Gray, see you, for giving us the opportunity within the 44th International Hospital Federation Congress to address this important subject for us, and for asking Fundación Sanitaria of Mollet to be here today explaining our experience. Thank you very much. who we are. Fundació Sanitària of Mollet is a non-profit foundation that delivers health and social care services to more than 165,000 citizens in the Vallès, in the North metropolitan area in Barcelona, only 15 kilometers from the Catalonia's capital. We are more than 1,400 professionals who deliver acute, chronic, palliative hospital services, but ambulatory mental health services too. And in addition, Fundació Sanitària of Mollet provides elderly people care services in residences and treats and care disabled people in a very specialized residence and open daily centers. So it's a very integrated institution. Here are some figures about us. Fundació Sanitària of Mollet has developed its own patient-centered care model. More than that, our person-centered care model, according to the main human ethical principles. Here are the figures about our year activity. About mission, vision, and values. Our essential proposal is to improve the quality of our citizens' life, and our principles are social responsibility, the professionalism, honesty, proximity, and innovation. That explains the how we make it possible. We are focused on people more than on illnesses. Our anthropological thought has oriented our institutional axis. Improving our citizens' life, that's the why, that's the essential, that's the aim, our essential aim, to promote, guarantee it, especially affects our institutional social responsibility commitment. For us, it's very essential, very important. The institutional social responsibility was the main focus that includes, obviously, institutional and planet sustainability too. In 2010, we opened this new hospital that had to be able to cover all our citizens, our patients and their families' requirements and their necessities too. And for more than 10 years, we have been working to progressively reduce the impact of our activity in the environmental and our carbon footprint. Hospitals, you know, consume a large amount of energy. Probably Mollet Barcelona University Hospital is the highest energy consumer in Mollet City. According to the plans to take care of more people, we have doubled our normal activity in terms of ambulatory care visits, emergency attentions, admitted patients, surgical procedures, daily hospital activities, and had the chance to maintain or reduce the carbon footprint at the same time. And how did we do it? The first, thanks to its innovating and modern architecture, Mollet Barcelona University Hospital has been able to reduce its light energy consumption. Due to different internal and natural corridors, you see, green light walls, taking advantage of the natural light in the workplaces, all the workplaces, we have reduced electrical consumption. This has resulted in an enormous carbon footprint reduction. 40% less light consumption on average, thanks of our natural corridors. And in addition, according to the Gallecs Natural Park next to the hospital, our green corridors are used by different birds, local species, to sleep every evening and nest. It's beautiful. In addition, this kind of light wells to contribute to improve the healthcare professionals' mood. The hospital was designed with a radiant ceilings. All places we will attend patients and family have this kind of installation. A radiant roof is based on a circular plumbing on the roof through the hot water running in a controlled temperature. This kind of very sustainable roofs allows us not only reduce the daily energy consumption and promoting efficiency, obviously, but offer our patients a very silent atmosphere, a familiar, calm place where to be inadmitted. Water collection has another important challenge for us. During the last 10 years, we have reduced the water consumption to 25% on average, despite an increase in normal activities. Mollet Barcelona University Hospital has a large reservoir to collect the rainwater, to water our internal corridors, and for cleaning some areas of the hospital too. In addition, different action to improve the water distribution system has been implemented during these 10 years, and we are always training our healthcare professionals in water waste policies too. Very important point. Geothermal system. The geothermal system of the Hospital de Mollet was the fourth largest project in Europe. This system is formed for 148 wells, 146 meters deep, using more than 20 kilometers of subterranean pipelines. This system allows the use of the energy stored underground. This is currently one of our most important strengths to promote green energy culture inside a hospital, taking advantage of the internal underground temperature and transforming it. We can reduce the energy demanding to cool or heat internal consumption water, and thanks to it, we can reduce our air-conditioned energy consumption. This is very important waste of consumption in hospitals by 30% on average. Only 5 years ago, our governance board supported us in changing the traditional energy supplier for a new one who could guarantee the certified renewable energy. So in this moment, 100% of the electricity we consume have come from renewable energy sources since 2017. Fundació Sanitària of Mollet has been working to promote different kinds of waste and recyclable internal processes among the professionals. In fact, currently we have managed more than 25 types of internal waste. Nowadays, we are involved in introduce and reinforce the circular economy all over the institution, not only for the Cook Hospital, in the residences too. Using non-disposable instruments, make the most of the tools, materials, etc., according always with the new nurses and physician protocols. In this area, the staff commitment is absolutely necessary. Our solar panel. We took advantage to design the hospital in a very traditional and respectful horizontal architecture next to the first. The 80% of the hospital roof was designed to be useful for a solar panel installation. Last year, installing almost 1,400 solar panels, we have covered all the hospital roof, about 6,500 square meters in the surface. This is the solar panel installation in our hospital. Beautiful. This new installation allows us to reduce an important amount of carbon emissions, 120 annual tons on average of carbon emissions. And at the moment, it provides more than 22% of the hospital's overall energy. And as a result of it, we can plant a new tree every working day. We have been working hard during these last 10 years. 10 years moving for you. This has been our dream. This is our purpose. During these challenging 10 years, green culture is part of the Fundació Sanitària of Mollet genetics code. From the outset, the culture of the respect for the environment, biodiversity, energy efficiency, and sustainability remains in place. Clear proof of this symbolism is found on the Social Work Foundation's logo, our Obra Social Aurora, our centuries-old oak tree, you can see it in the picture, preserved from the Gallecs Natural Park next to the hospital. When hospital was built is explaining our more essential soul. We're very committed to quality. The commitment to continuous improvement at Fundació Sanitària of Mollet has also resulted in the work on and the implementation for an integrated management system that meets recognized international standards, as well as being awarded accreditations and certifications in various fields, such as health and safety for patients and families, energy efficiency, environmental management, quality management and corporate social responsibility, ISO EFQM 500+, Joint Commission International Accreditation Standards, etc. Adding to the last certifications and accreditation recognized awards, and according to the Catalan government plans, this year we have been involved in the Environmental Charter for the 2030 Sustainable Development Agenda and being membership of the first Catalan Climate Action Summit. In the immediate future, awareness must be raised among the general public about the respect for the environmental aligned with the Agenda 2030, which we have embraced. The empowerment of our citizens, beginning with the living example of our employees, is part of the institutional strategic alliance for this current strategic plan 2021-2025. Last one, I finish it. Green culture is explicitly highlighted as one of the institutional principles that inspire our work, together with our ethical beliefs. The continuous improvement of quality and being proactive in the actions taken. Our institutional aspiration is to be able to serve as a leading hospital in culture in the health sector at the local, national, international levels, if possible. Our aspirational dream, ethical aspiration, is to be a showcase for sustainability and environmental respect and an open space for awareness raising. We aim to disseminate this essential genetic code, this environmental commitment to mark a better and sustainable future consistent in our institutional purpose, our aim, so to improve our people's life. So for that, thanks to listen. Thank you very much.
Before I let you go, I would like to ask a question. So I think this is a very impressive story of transformation over 10 years. Of course, the design at the beginning was very important, but then it had to go on and will continue probably in the next decade. I remember as a consultant, I always get stuck at the percentage. Once they told me large IT transformation projects, over 70% end up failing because of people resistance. Yeah. So when it comes to the transformation that is related to sustainability, to climate change, something in my gut feeling say we might experience less cultural resistance, but what has been your experience with having the right culture and mindset in embracing the change, this type of change?
Probably is the question. Is the main question for the future. But it's obvious that without professionals, we can move. Institutions can move without professionals. So we need their commitment. We need their soul and their effort. Probably this isn't the best moment to introduce the green culture in professionals because they are very tired, the same in part, and worried about the future, absolutely, after these 2 very working years. But I think there are different areas where professionals can be involved. For example, we have been able to introduce, to pass for 8 to 29 different kind of models to recycle or to generate waste processes. And it would be impossible without them, without technicians, nurses, and physicians too. But I think for the future, we have to relate with quality. Introducing the safety for patients and families, introducing very good standards of, for example, Joint Commission standards that guarantee the safety for patients, not over-diagnosis, not over-treatments. Be right is another way to involve them with the environment waste. Because one day more in a patient inside the hospital generates 7 kilos of solid waste. So we can introduce a commitment with environmental project, only doing the things right. So quality goes hand in hand with environment projects.
Thank you. Thank you very much once again. Please sit here so that we will continue with the panel. And I would like to introduce now Walt Vernon, the Chief Executive Officer at Mazzetti from the US. We're really excited to hear your insight. The floor is yours.
Great, thank you very much. Thank you all for sharing a few minutes of a time with me. So I'll start. My firm is a consultancy also. I'm an engineer, and we actually design buildings and healthcare buildings around the country. And actually, I want to start by answering the question that was just asked about culture change and the culture of the people inside the organizations. Because that's who I work with every day, is the people who are on the ground, managing the buildings, making things happen. And I guarantee you, these people are hungry to do something, right? They are hungry to make the changes that need to be made. We're all hearing, we're all aware. And I think one of a lot of the people are, they're waiting for leadership to set them free and empower them to do things. And so I think maybe the major lesson for you here is to let your people go and let them do what they want to do. I wanted to just share a couple things. So this is a new building. This one is a Stanford hospital. It's one of the most, it's been open about 2 years. It's one of the most energy efficient buildings in the US. And 2 lessons from this. Number one, in some ways, you know, when we design new buildings, we have a budget, we have a new site. It's kind of easy in some ways to do a more energy efficient building, right? But if you think about it, the problem we've got is that most of the buildings that are going to exist 10 years from now, when we need to have our emissions to 50 or less %, they exist today, right? We're not building these new buildings. And so a big part of our challenge isn't just about the new buildings we build, but it's about what do we do with our existing? And that is a much more difficult proposition. So that's one of the things we need to look at. A second point I wanted to make, the little picture here of a patient room you'll see on the right-hand side of your screen. This is a ventilation system. It doesn't look like much, I know. I'm an engineer, so it's very exciting to me, but it's a ventilation system that hasn't been done in healthcare before this particular hospital. And it was carefully designed to both reduce energy consumption, but to improve the removal of particles from the breathing zone. This was done actually pre-COVID, designed pre-COVID, but it actually had a remarkable impact on the quality of the air in this particular hospital. And the point I wanted to make here with this is courage, right? This hospital had to take a leap of faith in some ways, because I was convincing them this will be a really good thing for you. It will reduce your environmental footprint. It will provide quality patient care, but nobody's ever done it before. Let's try. And I think given where we are right now and the urgency of our situation, courage is one of the lessons, right, that I want to impart to you, because we need that. I don't have much time, so I'm going to go through some of this very quickly. I did want to just note that there's a lot of organizations out there that my firm works with regularly who are doing various kinds of research projects, various kinds of dissemination. The California Energy Commission in particular is very strong. We're doing all kinds of work around decarbonizing healthcare. We're doing work with microgrids. We're doing a lot of stuff to really push the boundaries of what's possible. And in some ways, I think the beauty of an organization like this, where we come together, is the opportunity to share and learn. And so I only have 12 minutes, and so I can't tell you everything. You have to call me later, and I'll tell you whatever you want to know later. I would point out the one in the far corner there, the International Federation of Healthcare Engineers. sort of an organization like this one, except those are the people who plan, design, construct, operate buildings. They've got actually an international awards program right now around carbon reduction. And I would highly encourage you all to get involved in it. It's free, it's easy, and it starts to recognize and create incentives, right, to start moving people down the path. So a great opportunity. I wanted to mention, tell you a quick story. So one of the things, in addition to my for-profit company, we set up a small nonprofit that develops renewable energy systems in low-resource countries at healthcare facilities. And so we've worked in India and Haiti and all kinds of places. A few years ago, we were working in Sierra Leone. And I was traveling around Sierra Leone looking at primary health centers. And we came to a couple of places, and they said, you know, in Sierra Leone, this was post-Ebola. We were doing recovery work after Ebola. And they said, you know, in Sierra Leone, they have a wet season and they have a dry season. And what's happened over time is the dry seasons are getting longer and drier. And they're running out of water in the small villages. And so they're going hungry. And then when the rainy season comes, the rainy season is shorter now and more intense, and it washes away the soil. And there were villages that we tried to visit, but the villages were gone because people had left because of these situations. And, you know, when we think about the changing climate, it's one thing for us in some ways, right, and what we experience and the resources we've got. But in many respects, this is sort of the ultimate issue of social equity and social justice. And what we do every day in this respect, even if we don't see it and we don't feel it, and it doesn't touch our patient who's in front of us, it affects them. Yeah? So remember that what you do matters, even if it doesn't seem obviously like it does immediately. All right. I want to talk briefly about carbon accounting. Carbon accounting is a very complex thing. I just caution you that there's a lot of greenwashing. There's a lot of people who make a lot of claims, and how you slice and dice things matter. I will say it's in the world of carbon accounting, when you look at the carbon impact of your operations, one thing is the transportation, right? The cars you drive. Another is the buildings, right? We all talk about our green buildings. The biggest carbon impact you have is the stuff that you use and the stuff that you throw away. And that's probably more than 50% of the footprint. I'm a consultant, and so I made my company carbon neutral 10 years ago because, in a way, I am part of your problem if you hire my firm, right? Everybody you hire, in a sense, is part of your carbon footprint. And so a lesson that I hope you will learn and think about is to start to pay attention to the carbon footprint of those organizations from whom you buy, because that matters, right? You have a profound influence on people who want to sell to you, right? And you can start to move markets by demanding that they do their job, yeah? Okay, I wanted to talk for a second about the National Academy of Medicine. This is an institution in the US that has just launched what they're calling an action collaborative. Historically, the National Academy has been an organization that writes grand reports about what ought to happen. They're now pulling together leaders from throughout the United States to come together and really think deeply about action and how do we take action collectively to move things. And so we've started publishing some tools. This particular book was a background paper for it that I was the principal author for. It's on their website, my website. You can get it for free. A lot of ideas about stuff you can do, right? There's a lot that's out there. So don't feel like you have to reinvent the wheel. Use what's there. The last thing that I want to talk about a little bit is the things that healthcare leaders, I think, need to be paying attention to in terms of how you start to manage this problem. We have a very short time, right? We're supposed to be making substantial emission reductions by 2030, and that doesn't mean the new building we're going to design. It means the buildings we have today and the stuff we're doing today. And so the first thing that I want to emphasize again is that leadership attention matters. I think it is really, really vital that every organization clearly signals, the leadership of every organization clearly signals that this is important. We have a moral obligation to be doing this, right? And you have to own that, and you have to help your people understand that. You have to give them the impetus to make stuff happen, and they will. I think that, I don't know if you guys know the name Don Berwick. Don Berwick used to run CMS in the United States. He was one of the people who created the vision for healthcare quality that we use in the United States through the Institute for Healthcare Improvement, IHI. Don likes to say when he created his visions of healthcare quality, he had 6 dimensions, and it was about timeliness and safety and effectiveness, right? And he said at the time, I didn't include carbon, and it is now time for us to think about embodied carbon as a metric of clinical outcomes and clinical quality, and I think that's right. And I think each of you has the opportunity, it isn't that hard, to do an accounting of what is our carbon footprint, and to think about it not in terms of square footage, but think about it in terms of covered lives or patient encounters, right? What is our tons per patient served? And start to work on that. If you start to pay attention to it, it won't happen overnight, but if you pay attention and you communicate and you call on the best of your people, they will deliver over time. Second thing is this idea of focusing on your supply chain, right? It's easy to talk about the buildings. I'm an engineer, so this is what I do. There's a lot of attention on the buildings. Transportation is starting to move in a good direction, right? We have the EVs, there's hydrogen, there's a lot moving in transportation. But the issue of supply chain is of such critical importance. It's the biggest part of your footprint. And it's the part that's least understood and least managed and most opportunity, I think, for making a difference. So focus there. A lot of people who can help you. A lot of people are buying carbon offsets. This is an issue, right? And this is part of the way people will say they've gotten to carbon neutral is because they buy offsets. That really can be a tricky thing because of the quality of the offsets. You may be familiar with that or not. In California, where I also live, a lot of the companies bought forestry offsets. And then the wildfires came and they burned down all of the forests that people had bought offsets in a way so how does that work, right? How does the offsets work? So to the degree that you're thinking about using offsets in your calculations and in how you're thinking about your carbon footprint, be very careful and get help from people who know what they're doing. And really this last idea, really just measure and implement. Do something, just do something. There was a person at the California Energy Commission who was interviewed. In California, right, we've done a lot of stuff, and it doesn't all work. Sometimes people make fun of us in California because we sometimes move too fast and things don't work. And somebody was asking him about that. Shouldn't you wait until you have everything figured out, right? And Commissioner McAllister said, you know what? The dangers of moving too slow are far greater than the dangers of moving too fast. And so I leave you with that, right? Don't move too slow. That is the danger. So with that, I'm available for questions, and I appreciate your time.
Please, Walt, take a seat there, and I'll ask you for a telegraphic answer to the question, but you have an international experience in working with hospitals from different countries. And one very strong message we're receiving also from COP26 has to do with inequalities when it comes to climate change. So dealing with climate change, probably, if I want to oversimplify the message, if you come from the south of the world versus the north of the world, and again, this is a simplification, but it presents very different type of challenges. So we're here trying to create a global story, but then the local realities varies a lot. The cost of and access to capital to do the right things, the starting point of your health community, the access to medicine, the access to, and how affected your country is in climate change. These are all different factors. Do you have any example in your experience that reconfirm what I'm trying to say here?
Yes, clearly there are substantial differences in the way that medicine is practiced, in everything from local weather conditions, the availability, in many places, they don't have access to recycling programs. So how do you implement a recycling program inside a hospital if there's no place to take it, right? So the situations are very complex around the world, and everyone is different, everyone is unique. One of the serious issues actually has to do with energy poverty, if you will, that in many parts of the world, they don't have enough energy, enough electricity to be able to deliver effective healthcare services. And so there the issue is they need whatever they can get. And so the problems are extremely complex, and there are no easy answers. The main answer, I think, is to pay attention, to be aware, to act with courage.
Thank you. And so we have still 30 minutes to go for our session. I want to make sure that we remain with a good energy. Can I ask everybody in the room to stand up for a second? Stretch your arms. This is always helpful. And even more helpful than this, look at your person on your right or left and give a big smile, because that, even with the mask, it gives us energy, it keeps us up. Good. I think we are even better equipped now to move forward for our last mile toward the end. I am extremely pleased to introduce Dr. Nick Watt, the Chief Sustainability Officer at NHS England and Improvement in the UK, who's connecting with us remotely from the UK today. So a big round of applause for Dr. Nick Watt, who should be connecting with us. We look forward to hearing your insight.
In clinics and hospitals all around the world. I'm going to be brief, because if I'm brief, it means we have more time for discussion and for questions, and that's where the fun is. Let me talk very quickly about the work that the NHS is doing. I'm going to talk about why we are doing what we're doing. I'm going to do that very quickly. The why is very simple. The climate crisis is a health crisis. The NHS was founded with a pretty simple purpose: to deliver high quality care for all, now and for future generations. Full stop. You cannot do that. Simply not possible unless you respond to climate change. The NHS knows this. We have known this for 12 years now, which is why we have worked to reduce our emissions, and so far we're really proud to say have managed to reduce our emissions by over 30% against the 1990 baseline. The why is simple. The other reason, though, why the NHS really cares about this is, God, it energizes our staff. Every single year we go out and we ask. The NHS is the 5th largest organization in the world, the 5th largest body. We employ 1.4 million people. Every single year we go out and we ask our 1.4 million healthcare professionals, what do you want to see the NHS do more of? What do you want to see us focus on? Where do you want to see us pay attention? Every single year, the response comes shouting back. It comes shouting back. We want to see the NHS tackle climate change. We want to see the NHS live up to the oath that I signed at the beginning of my medical career. First, do no harm. I was really worried in 2021 that we were going to ask that question again, and the response would be, could you leave us alone? There's been a lot going on in the world in 2021, and you can imagine people could be forgiven if they had other things on their mind. We asked the question though, just a few weeks ago, it didn't decrease the number of healthcare professionals. It increased by 2 points. 92% of NHS healthcare professionals want to see the NHS in 2021 during a pandemic put more of its time, its resources to respond to climate change. They want to see that response to COVID align with our response to climate change. That's the why. The what is simple. Big planetary scale problem, net zero. Net zero by 2040 for the emissions we control directly. Net zero by 2045, not just for the emissions we control within the four walls of our hospital, but for our entire global carbon footprint. I completely agree. We heard that we need to be skeptical. There is a lot of nonsense out there in the world when it comes to people reporting on the work that they are doing when it comes to climate change. If someone won't tell you the emissions that they are tackling, if they won't tell you which scopes, they are lying to you. If someone won't provide short-term targets, they are lying to you. If someone won't provide absolute long-term targets, they are lying to you. And if someone won't tell you how much of their emissions they are offsetting, then their target doesn't count, full stop. So for the sake of transparency, 2040 for scope 1 and 2, 2040 for all 3 scopes, and a few things out of scope, because we're going to take account of those as well. Short-term targets, an 80% reduction by 2028, and we plan to offset 6% of our emissions for the direct target and 8% in total for the indirect target. That's our transparency there. That's the what. The how is where it gets interesting, right? The NHS has cared about this for a very long time, but really only just stepped up, I think in the last 2 years, increased the amount of work we are doing here by an order of magnitude. No longer just a small team of 4 or 5 people working in a sustainable development unit. Now a team of 140 healthcare professionals, net zero medicines teams, net zero ambulance teams, net zero estates teams, net zero nursing, medical allied health professionals, all starting to engage in this. We've invested heavily, 130 million in the first 6 months, another 200 million in the next 6 months into climate smart healthcare, into energy efficiency, into putting solar panels all over the roofs, all over the country, into zeroing the emissions from our fleet. We've innovated. We have, you can't see it, but 200 meters just over there, the world's very first zero emission ambulance. There are actually 2 in existence. We are really proud to be able to say that we have both of them. One of them fully electric, carrying patients today, currently in Birmingham. The other one, electric hydrogen hybrid. You can go 300 miles on a single go, can cover the entirety of the patient need that the NHS has. I agree, supply chain is a big problem as well. The manufacturing processes, the logistics around it, the waste. We've been very clear. The NHS purchases from 80,000 suppliers every single year, £62 billion worth of spend. By April 2027, the 1st of April 2027, 1 minute past midnight, the NHS will no longer purchase from anyone that does not meet or exceed publicly our commitments on net zero. We are not interested in doing business with companies that are not aligned with our values. Now, 2027 is a long way off. That's 5 years away. So we have some interim steps as well. The very beginning of 2022, the very beginning of next year, we're going to put 10% weighting for carbon, for net zero, for climate change into every single one of our tenders. April 2023, all contracts over £5 million, they have to start to align with our procurement processes as well. They have to start to align with our net zero trajectory. We're just not interested in doing business without that. That's a scary sort of thing to say, and you can imagine 80,000 suppliers, you might get a few that say, what are you doing? Quite the opposite. Only a few days ago, the NHS, we were really excited, really proud, in fact, that in response to this, our 15 biggest suppliers across a whole range of different healthcare industries, pharmaceuticals, medtech, logistics, the people that make and wash the scrubs in the hospitals, they came around and they said, listen, we've thought about this. It is going to be complex, it is going to be hard, but we think we can get there with you, and we're very happy to publicly commit, and we're very happy to disclose our carbon, and we're very happy to be held account, as long as you're happy with us holding you to account as well. Absolutely. So all of this, the NHS made its first commitment, first healthcare system in the world at a national level to commit to net zero. We did that 12 months ago. We are really excited, cautiously optimistic, but really excited to be able to say that 12 months later, all of those things, the 300 million pounds, the innovations in ambulances, the engagement with our supply chain, we've reduced emissions by 1,260 kilotons of carbon. A big number because the NHS is a big, big healthcare system. We're able to do that because of the passion, because of the excitement from our doctors, our nurses, our allied health professionals. The first step was difficult. The next 3 will be even harder, and the next 10 after that will be even harder again. The only thing that gives us hope, encouragement, is that we know that 9 out of our 10 staff desperately want this, and we know that we're not alone. We know that there are healthcare systems around the world. There were 14 yesterday that made similar commitments at a national level to reach net zero. That is so exciting. That's what gives us hope. Anyway, I'm going to stop there. The questions will be more interesting than what I have to say. Thank you so much.
Thank you, Nick. This is very, very inspiring, and it's very inspiring to see how a large and very important player like NHS does not decide to just wait, follow, and perhaps let others take the first risk, but is purposefully decided to take a lead and to take the driver's seat, because there's something about that leadership and creating role models that, with your magnitude, with your reach out, that can really inspire the speed as much as the depth of the change. So thank you for that. And the question that I have for you has to do with how do you, so a net zero program is complex, right? It goes up to 2045 in your case. You have all these marathon to go, and then you have to roll these as a project, you have to set priorities. So what's the balance between creating the fertile place and land for solutions to emerge organically all over the place, and on the other side, with precision, with professionalism, decide what needs to be done first, what is the right sequence of interventions? How do you work on setting those priorities and ensuring that you can let the project roll in the right direction and with the right speed and magnitude?
I mean, it's a very good question. If I ever have an answer to it, I'll let you know. It's that's the whole game, hey? This thing is complex. You're entirely right. You don't get to just do 1 or 2 or 3 things. You don't get to just do 10 things. You have to do everything. The response to climate change is not just a couple of things and then you stop. You keep going until you have changed the very nature of healthcare in the NHS, yes, but around the world. And that is going to take time and it's going to be complex. And we don't really know, right? No one really knows what that end point looks like just yet. So there's a lot of uncertainty and we're going to have to be okay with that. The things I think we are focusing on, to be honest, at the national level, we will do the things that we can do that no one else can. We can invest at scale, right? We can invest in new hospitals. We have set up a new funding program to help invest in climate smart healthcare. We can set standards. We've created a new net zero hospital standard, 700 pages, very technical, very boring, but that's going to start to drive innovation for our new clinics, for our new hospitals. We can manage procurement policy. And then I think once we've done all of those things, and those things are kind of the boring part of healthcare, right? It sort of leaves the realm of the healthcare manager and enters into the realm of the patient, the realm of the clinician, the realm of the staff on the ground. And at that point, that's where it becomes interesting. Our job is to create that space for them to step into it. Our job is to make sure that it is clear, it's in everyone's job description. We have amended the NHS Constitution to make sure that everyone knows that the response to net zero is their problem. It's something that we all have to do together. Everyone has a piece of carbon that they can take control of. They need regular communication, they need visible leadership, they need time, they need funding, they need permission to step into that space. That's how you get there. 1.4 million decisions being made sustainably by 1.4 million healthcare workers every single day of every single week, month, and year.
Fantastic. Thank you. Very inspiring. Thank you once again. And please stay with us. And I can see Dr. Elizabeth Baka is also now on the screen. So we all connected. And I would like to go for perhaps a last round of questions, or let's see how we do with time. Maybe we can do even 2 questions. But I'll start with Dr. Duran. And I'd like to take you back a little bit to the topic of leadership skills, and indeed to lead this change. We want the leaders to be, one thing that I read about the NHS was that they are appointing senior leaders to follow each different part of the programs, right? And this shows the importance of accountability, of making sure that we run. But are those leaders equipped technically and also from a mindset point of view and the leadership skills to run this change? What is the gap? What do you think is important to work on in the coming years?
Yes, it's a good question. Thanks. I think this moment we need to shift the point of vision, because quality institutions are very well balanced strategy structures, channel means, etc. But during the last decades, probably we have put an emphasis in thinking green institutions in structures, architectural, engineering. In this moment, I think we have to shift the vision and to put the sustainability and the green culture in the strategies. What are we doing and how are we doing all the things? And finally, why are we doing that? Because we have a reason, we have a purpose to improve the quality of life of the people. We have to be absolutely sustainable. So it's not in the structures. Green culture, it is the strategies, okay? And the second problem is how to make possible to put the effort or to realize this mission in all our processes in the organization, not only for the strategic processes, which alliance, how to manage with others, quality projects, the vision of the patient, families, etc., but the key processes, assistential processes, have to involve in green culture too, in sustainability too. And finally, the support processes too. So not only change the structures to strategies, but to put the strategies into processes and involve the professionals. Isn't easy, but I think it's the only way, I think.
Thank you. And indeed, when it comes to bringing the topic all the way up to the strategic level and therefore involve the board and then the execs, of course, in the understanding the challenge, what we must recognize is that bringing it at that level is not enough, because then you have to recognize that sustainability remains a systemic issue, right? And so you need to be able to influence external stakeholders, work with external stakeholders. A lot of things that are not within your normal sphere of influence and authority as a leader. And that's maybe one of the most profound changes that at the leadership level we have to envision. And I don't know if you have, Walt, an opinion on that, how ready the leaders are, in fact, to lead also externally, not only, and without the authority, because leading when you have power and authority, I think we have quite a lot of great leaders that master how to do that. But then leading, when net of power and authority, it's a different game.
You know, inside my little organization, just because I have power doesn't mean everybody does what I tell them to do. I think leadership is fundamentally not about, in a way, power and force. I think leadership is about persuasion. And I think really, you know, in some respects, I think the world understands the urgency of our situation. And I think the people who are working in healthcare understand the urgency of the situation. And I think Nick said it very well. I think every person inside of an organization has a role to play. And I think the job of the leader in some ways is to create clarity about where are we going? What is the job? It's not the job of the leader to tell every single person what they have to do, right? But here is where we are going. And so I think it's about clarity. I think it's about consistency. I started measuring how many women were in my engineering firm 20 years ago, and just measuring and reporting. And through doing that, we've approached 50% women in the firm. You know, it's about consistency, continuing to say, this is where we're going and here's where we are. Let's get better, and then communicate, right? I think if you're clear, if you're consistent, if you communicate, people will follow.
Thank you. And Nick, one initiative that we recently launched also at Deloitte together with the UN Global Compact is to interview and celebrate the chief sustainability officers. And we call them the visionary heroes of the decade of action. And why we call them heroes is because we recognize that there's a lot of work that the role that you have as a chief sustainability officer, and I wonder if in the future we will see even more growing of this role in the hospitals and more broadly in the healthcare system in general, industry in general. So this is a role that is supposed to do the very hard job of bringing all the different stakeholders together under a vision and making sure that there is buy-in, that there is an understanding that this is extremely important at every level. So I heard you saying that there will not be room for certain type of partners for NHS in a few years if they don't buy that vision. And that is very convincing and very important, but I am sure that you also have to work also in other ways to make sure that you bring your stakeholders on board. Can you give us some examples of that? How difficult and how exciting at the same time is to work with all the different stakeholders?
Absolutely. Listen, the Chief Sustainability Officer, that role is so critical. Someone that can manage the politics, manage the financing of this, manage the coordination, the analytics, the standards, keep the pace, make sure people are running, sprinting. The climate crisis is a health crisis. Let's act like it. It also is a job that I think we will start to see many, many more of, you're right, around hospitals, healthcare systems all around the world. And then I hope we all get fired. Because ultimately the job should be to delete yourself, right? The job should be to get to the point where everyone is just doing this because this is just core common practice. And so maybe to answer your question, that's how we've tried to set our work up. I chair the sustainability board for the NHS. Now on that sits the chief commercial officer, the director of procurement, the chief nurse, director of estates, the director of improvement, director of transport. That board is made up of people who, yes, we do the coordination of the finance. Yes, we do the coordination of the analytics, of the politics, but God, they go and deliver. They do everything there that gets this stuff on the ground, that reduces the actual physical kiloton of carbon, and that's really important. It's really difficult because they have full-time jobs and they're doing other things. What it means is that you have to be okay with people doing this their own way. You have to be okay with people getting it wrong sometimes. You have to be okay with people doing it in a way that you wouldn't necessarily do it, and that's just going to have to be fine. But those commitments that I talked about on our supply chain, If it was just the Chief Sustainability Officer saying that, then I think we should all roll our eyes and yawn. It isn't. Those commitments were developed by the Chief Commercial Officer, developed by the Director of Procurement. It is their commitments with their team delivering that, not me. And that's the really important part. The collaboration is tough, right? Because inherently, no matter how far or how fast or how impressive something is, it is never enough. And that means that you need to simultaneously celebrate the fact that we have come so far from where we were yesterday, and yet we still have so far to go to where we need to be.
And maybe to inspire more people to actually become a Chief Sustainability Officer, we need plenty of them in the coming years, and not to scare them too much that the job will disappear, which I hope as well. I've actually read recently an article that says Chief Sustainability Officer might well become the next stepping stone to become CEO. So we might see in the next decade a lot of new CEOs that comes actually from having had the role as a CSO. So we will invite you again in a few years, Nick, and see where you are with that. Okay. Maybe we're doing pretty okay with time, but I have one last question for Dr. Elizabeth Baka. And Elizabeth, do you have, at this point, we've heard so many great insights, any advice for healthcare leaders looking to get started today, tomorrow? Hopefully yesterday they already started, but there's a lot of people that are getting started as we speak, inspired by this session, inspired by the COP. So get started on climate change responses within their own organization. What's your advice for them?
Well, I love that question. And I've been so energized by everyone who's sharing their stories today. So I think part of it is not to get overwhelmed, right? So I think sometimes, to Nick's point, it looks like there's so much to do. So just take that first step. Find out who the allies and all of the supporters are. As we've heard, a lot of employees are really looking to do this and passionate about making change. And then I think that the big piece is this is not just a side thing, it's really part of your entire enterprise strategy. And so really starting to think about what areas you can align it with and where there's some action to be taken. I also just wanted to add, because I think it was so powerful hearing things from everybody. I think the other option and opportunity is to think about leapfrog innovation, right? So with a story around being in another country, I spent time in Nigeria, and I remember they called it, the electricity would go out all the time while they were doing surgeries, actually. And so there's actually this opportunity, even though there seem like a lot of challenges, to actually use this to innovate beyond what current state exists to get to better health now.
Thank you. One last piece of advice for who's looking to start now or accelerate now from you, Dr. Duran. What do you think?
Well, I think we have to put the environmental commitment in our ethical dreams. I think it's an ethical response for institutions. We have to put in our ethical agenda.
Thank you. Well,
I would say commit. Commit to doing something and then figure it out. But you got to start. I agree with Elizabeth. Commit and go.
Thank you for that. I feel particularly connected with that commitment. Not everybody have the same privilege I have, but I have 3 small children. And I can say that there's nothing stronger than that. Every morning, every evening, every day, seeing them grow and thinking, what am I doing today to ensure that they can actually have a future? And that is, for me, I don't need nobody to power up my energy, right? That commitment is in front of my eyes every single day. And I wish the same for those who do not have kids or cannot have kids for whatever reason, but commitment, it is indeed important. Nick, you got the last word here. What's your advice for people who are starting or accelerating right now as they're listening to us?
I mean, I agree. Commit to something bold, make it big, make it almost impossible, right on the verge of what you think is feasible, and do it anyway and figure out how later. But then follow it up. Follow it up with a bit of anger, follow it up with a bit of passion, follow it up with something tangible that you can do at 8 a.m. tomorrow morning. And then do the same thing at 8 a.m. the next morning, and the morning after that, and the morning after that. Do something tangible. That'll be how you learn how the next step goes. We don't need to know the entirety of the way through this journey, but we do need to start yesterday.
I would like to make a big applause for all our contributors. I would like to thank you very much for staying with us for this session. I have a very few last remarks. Please share your key takeaways from the session and post it in the Congress app and or on social medias. The recording of this session will be available on the event platform in a few hours. And we also have the IHF Awards ceremony this evening at 6 p.m. Central Eastern Europe time. We hope you can join us there, and we will have a short coffee break at the catering area downstairs, and the next set of parallel session will start at 5 p.m. Our time here. Tomorrow afternoon at the closing plenary, the Minister of Health of Catalonia and the Director General of the Dubai Health Authority will share key features of their hospital and healthcare delivery systems and discuss the importance of international collaboration. So please mark this in your Congress calendars. Thank you very much for your presence here, and I hope it was an interesting session for you. Have a wonderful rest of the Congress and the evening. Thank you.